this afternoon. We've just seen, haven't we, the personal impact of this pandemic, and we're now in a situation where we have more than 80,000 deaths in the UK, the number of patients in hospital with COVID-19 at a record level. First of all, just reflect for me, if you would, exactly where we are in terms of this crisis.
Well, this is the worst we've known it. We are used to having what we call winter crises every year, but this is unlike anything doctors have experienced in recent times. We are seeing more patients with serious illness than in any recent years in the past. We know that more than half, well, all regions are now seeing more COVID patients in hospitals than during the peak of the first wave. We know that in London, for example, there is a major incident that has been announced by the mayor because the projections are that by the 19th of January, we may be 2,000 beds short. This means that patients are being diverted to other hospitals, and that will also then have a knock-on effect as those hospitals become overfull. So we really are on the brink, and it's a very serious situation. I should also mention that we mustn't forget the impact of all of this on patients who do not have COVID. There's a report today that suggests that 10,000 fewer patients with non-COVID conditions were seen last week in the NHS. And there are reports that we've seen a drop of about 50% of patients with cancer being treated, and with many reports of cancer treatments being delayed, scans being delayed. So whilst we are focusing on the deaths of patients with COVID, we mustn't forget there are many other patients with serious illnesses that are also being impacted and who may also not be surviving because of these pressures.
And of course, another big issue is sickness amongst NHS staff. It's something that you've written about in the papers today. People going down with COVID-19 who are meant to be on the front line looking after the rest of us, adding to the pressure.
I mean, this is a really serious problem that we have got acute workforce shortages. In some hospitals now, the staff to patient ratio is such that nurses in intensive care units, for example, are being asked to see to care for more patients than is actually officially recommended. We know that there are about 46,000, or reports that 46,000 plus staff are now sick with COVID. That is having a real impact on our ability to provide services. And I should also add that it could jeopardize or threaten the vaccination program. There are many examples of doctors and nurses and other staff whose shifts have been cancelled to vaccinate patients because they've been positive for COVID or become ill. So what we are calling for in the British Medical Association is that health and care workers must, as a priority, be vaccinated now. We've set a deadline that all high-risk healthcare workers should be vaccinated within the next 2 weeks, and everyone else by the end of January. Because if we see more staff falling ill, that will have a direct impact on the ability for the NHS to care, and it will be patients who will suffer. We must protect our health and care staff so that we can be there for patients to look after them.
Just to pick up on something you said there, are we at a stage now where care for people with COVID and with other issues that are in hospital, that care is now being diluted or being rationed because there aren't enough staff that are needed?
I mean, I don't even think that's a hypothesis. That is unfortunately a reality. We know that large numbers of hospitals have stopped providing routine services. So that is, for want of a better word, rationing care. As I said, I don't think it should be as simple as stopping non-COVID work, because many patients who do not have COVID are also seriously ill and do deserve and need to be seen. But the reality is that the NHS is not able at the moment to provide the range of services that the population demands. And there's only two things that can be done to stop this. One is, of course, to make sure and to ensure that the infection rate goes down. What we're seeing at the moment is probably an after effect of the mixing and that occurred during the Christmas New Year period. There's always a delay between the infections occurring and patients then becoming ill and becoming hospitalized. We must now, in the here and now, ensure, and the government must make sure it does absolutely everything, pulls out all the stops to reduce further spread of infection. And the second, of course, is being as rapid as we can be in vaccinating the population, starting, of course, with those who are the most vulnerable. But as I've said, it's vital that health and care staff are protected with with the vaccination, because health and care staff need to be there to care for patients. And of course, to then roll that out to the rest of the population according to the tiers of priority, absolutely as soon as possible. That has to be the priority, together with reducing infection rates.
Yeah, we know it's London hospitals that are largely the ones that are struggling the most. But of course, mixing amongst households over Christmas in London was banned. So are you essentially saying that people broke the rules over Christmas and that's why we're in the situation we're in?
Well, the rules were changed for Christmas very much at the last minute. So, in fact, there was a lot of mixing that would have occurred during the month of December until the last minute, when the government changed its rules in London. The second thing to say that London is a city with large numbers of people who aren't staying at home because they're going out to work, and there needs to be really a much more effort, an emphasis on all the people who go out to work, to not assume that your work colleagues are somehow safer than the general public. So there needs to be a very clear expectation that anyone you come across may be carrying the virus without them knowing about it. And we need to make sure that everyone who's mixing, and as I said, there are millions of people who are still going out to work and mixing, we need to also target efforts to stop spread between colleagues and people who are working together.
Does the government need to introduce an even stricter lockdown?
I think what the government needs to do is make sure that the measures of the lockdown, which are currently in place, need to be adhered to. As I said, I don't think it's about diverting our attention on people walking in a park necessarily. I think it is much more about areas where people do mix. As I said, I think that people are mixing in the workplace. They are mixing when they go out to get a takeout and so forth. We need to make sure that in all of those instances, every single episode, when people are near each other, they are physically distanced, and if they're unable to make sure that everyone is wearing a mask in the proper way, that is what needs to happen. And of course, there are going to be instances where you will need to have enforcement and more adherence, more monitoring. So yes, we need to do whatever we can to ensure that everyone sticks to the rules, combined with a massive effort to vaccinate as many people as we can in as short a time period that is possible.